Hi, Premier. You were making the good news announcement that mass vaccination for the general public was starting yesterday. With the failure at Vancouver Coastal Health in terms of actually getting appointments booked, how are you owning this, and will you be apologizing to the public?
Well, certainly we were disappointed with the results in Vancouver Coastal yesterday. We have other health authorities that did very, very well, making sure that those over 90 years old had appointments made. Some 15,000 already booked of the 50,000 we expect to do throughout the week. But certainly we're disappointed with the results in Coastal Health, and Minister Dix has taken responsibility for that on behalf of the government and the service provider. I also understand has made comment just in the past few minutes. So I'm confident that we're on the right track. I think British Columbians should take comfort in the fact that we are preparing to get through phase 2 and get as quickly as we can to phase 3. I think it also connects into the announcement that we've made today. If we are going to come out of the pandemic stronger than we went in, we need to make sure that not just the vaccine process rolls out in a safe and effective manner, but also that the infrastructure that we all depend on, whether it be our airport infrastructure across BC or the intercity bus network that has been struggling because we have been, as British Columbians, listening to the call of Dr. Henry and staying in place. As we come out and get back to more normal activity, we're going to need everybody pulling together, just as we pulled together to get to this point. With respect to yesterday and the call center, profoundly disappointed, take full responsibility for that. That's the responsibility of government to make sure that we have the right people and infrastructure in place. And we're taking steps, as you've already heard from Minister Dix and others, to correct that today and throughout the rest of the week, and indeed throughout the rollout of the vaccination program.
Vinder, do you have a follow-up?
Yes, and just wondering if you can, you said the issues are being worked on. Minister Dix also outlined that for us. Can you guarantee that these kinds of issues won't keep creeping up as we go through this registration process?
Well, we had 1.7 million calls yesterday at the same time that we were opening up BC Parks. The BC Parks network worked very effectively because we had the experience of last year to fall back on. We now have the experience of yesterday in Vancouver Coastal. We have the positive outcomes in Fraser Health. So we are having the health authorities talk to each other. Adrian is overseeing that with Dr. Penny Ballum and Dr. Bonnie Henry to make sure that we correct the shortcomings of yesterday so that we're better tomorrow. I know all British Columbians understand that when you're undertaking the largest immunization program in BC history, there will be some bumps along the road. And the good news is it was day one, and we have many, many days ahead of us. And I think all British Columbians are focusing on how quickly they can get their loved ones vaccinated and then themselves as we get back to more normalcy as we move into the summer.
Our next question is from Richard Zisman, Global.
You mentioned the success at Fraser Health. Fraser Health had success because they had an online booking system. Was it completely unacceptable that the province was not prepared to have online booking systems in every health authority? And why, when Fraser Health was working on an online system, were the other health authorities not doing the same?
Well, as you know, Richard, every part of British Columbia is different. Every health authority has different issues that they have to address throughout not just the pandemic, but regular operations of our acute care system and all of the other health services that are provided across British Columbia. I think we've acknowledged fairly clearly that we had a failure of a contractor yesterday, and steps are being taken to correct that.
He said other health authorities did very, very well. But from what I understand, that's only because those other health authorities put in place their own call center backup support that they did have to rely on in the end. So if Vancouver Coastal Health was the only one that didn't have a contingency plan, and that's why they failed so badly, whose fault is that? Is that on the health authority or is that on the province?
Well, I mean, you can blame whoever you want to blame, quite frankly. We had a bad day yesterday, we being all British Columbians that live in Vancouver Coastal Health. We're taking steps today to correct that. Other parts of British Columbia, other health authorities had contingency plans that weren't in place in Vancouver Coastal. They will be in the next number of hours. The contractor was highly regarded and respected contractor. We had every expectation that they would be able to meet the the conditions of their contract. They didn't. They acknowledged that, and I think we need to move on. I'm happy to accept responsibility and blame for this if that's what British Columbians are seeking. But I think more importantly, British Columbians are seeking vaccinations. We have more products now approved by Health Canada. We have more product coming to British Columbia, and we have a system in place that failed on making a booking yesterday. But we continue to vaccinate British Columbians, over 300,000 already, and hundreds of thousands of more before the end of this month.
Tanya, do you have a follow-up?
Yes, thanks. Going back to the lack of online booking opportunities, online booking portals are currently running in Yukon and Nova Scotia. They were built by an Ottawa-based tech firm, Can Immunize. They were contacted by other provinces as well. It's unclear if BC was one of them. But did the other health authorities here not have a portal because they tried to design one in-house and they just couldn't get it done in a timely way? Or did they try to hire an outside contractor? Is there any indication of what was going on with each individual health authority and if it's solely on them to get that up and running?
Well, I think that would be a better question for Minister Dix, who has been overseeing this from the Ministry of Health. I do know that we have full confidence that we'll be able to deliver vaccines to British Columbians through Phase 2 and into Phase 3 in the weeks ahead. Where we're going to see significant volumes will be in April when we move to Phase 3. We're dealing this week with those 90 years of age and older. We did not anticipate 1.7 million calls for that small cohort of British Columbians. We should have been better prepared. We've acknowledged that. And the terms of each health authority putting in place their infrastructure is entirely up to them. And we oversee that and manage it in the best interests of British Columbians. And I think that we'll see, again, over time. I appreciate that today's the day we talk about the failure in coastal health, but I think we should also talk about the exciting opportunities that will flow from this for many, many British Columbians as they get vaccinated and we start returning to normal. That's what British Columbians want. And are they frustrated in coastal health by the challenges with the call center? Absolutely. So am I.